Hi, my name is Mark Brezinski. I'm the CEO of the Functional Movement and Fitness Corporation, also known as SeizeHealth. I'd like to talk a little bit about why we came up with SeizeHealth. If you look at the way musculoskeletal disease is treated in the population, or more importantly, the success of treating musculoskeletal disease in the population, it's poor. And why does that occur? Well, there are several reasons. First, this area of medicine is pretty much the only one that does not have, as a surgical branch, but does not have an internal medicine branch associated with it. So most of our exams are dictated by orthopedic surgery. If we look at neurology and cardiology, they have neurosurgery and cardiac surgery. So if we imagined if our cardiac exam was dictated by what cardiac surgeons need, or neurosurgeons need, it would greatly limit what we would need to know other disorders, meningitis, Parkinson's disease, hypertension, arrhythmias. None of these would be covered in the surgical branch. And so the same thing we see with the orthopedic type exam that's the standard in the field. The second is that you have to consider the kinetic chain. And to date, the majority of patients are treated like changing a tire. The focus is on an individual joints, and joints are not independent. They're not independent of the muscles and the ligaments around them, rather than in addition to the other joints. If we look, for instance, at the back is dependent on everything from the foot, the ankle, the knee, the hip. Most back pain is caused by problems below the waist. This is something patients struggle with, and in our videos we try to explain why this is. Secondly, neuromuscular components are critical. You need to understand the nervous system. Muscles are controlled by the nervous system. That's why it's called neuromuscular. And problems with the neuromuscular system may account for at least or more than half the problems we see in joint disease. So we use the example of the patient who comes in with knee pain. They get an exam, they get an MRI that shows a meniscal tear, get surgery for the meniscus, and don't get better. And when you have them do a single leg squat, their knee is all over the place. And the problem is the fact that their neurologic or muscular control in their hip and ankle is not good, and their knee wobbles all over the place. And that's what the source of their pain is. And so in addition to the neuromuscular control, comorbid disease, some musculoskeletal diseases present as non-musculoskeletal diseases. The reverse happens. And even when you have a musculoskeletal disease, it can be impacted by medical problems. Hypertension, cardiac disease, all affect how you treat a musculoskeletal problem. And musculoskeletal problems can affect the way you treat medical problems, other medical problems. And so you have to take into account that component. And finally, integration is critical with PT and fitness centers. So right now we use primarily a black box approach. We send people directly to physical therapy, and contact is lost. We don't have direct communication and constant feedback from physical therapy. In addition, physical therapy only lasts a limited period of time. And most of the disorders require movement, exercise for periods such as a year. And you're not going to get that in physical therapy. And so we need communication with the fitness centers. Patients need to be followed to physical therapy. Patients need to be followed in the fitness center. And that's what we do. So these are the problems, are among the reasons why knee pain, hip pain, back pain, runners have all kinds of problems. These issues are not dealt with, we believe, appropriately. And we demonstrate that with our video, and we demonstrate it with the way we treat patients. I'm Mark Brezinski, and I appreciate your time. Thank you very much.